Rodney Lear.
And welcome back to Sunday Morning Magazine. In the studio with me now is Dr. Christopher Lewis. He's founder and president of Village Life Outreach Project. Village Life Outreach Project partners with local volunteers to improve the quality of life, health, and education for those living in Tanzania, East Africa. He's here this morning to talk about the mission of the organization. It's our pleasure to welcome Dr. Christopher Lewis to the show.
Thank you for having me.
Now, tell us about your first trip, the first time you made it over to Africa. Explain how that experience inspired you to make a difference.
Well, my first trip to Tanzania, East Africa, was actually by myself. I went as part of my training and residency. I trained here at the University of Cincinnati in their family medicine residency training program. And they have a great program to train residents and young doctors on how to do international health. So I went over to Tanzania and stayed for a month as part of my residency training. I worked in a hospital there, a rudimentary hospital at best. It's one of two hospitals in the entire district of 500,000 people. The hospital, they do a great job of taking care of people, but sometimes they don't even have medicines. They don't have running water a lot of the times, don't have electricity a lot of the time, but they still do their best to take care of folks. So I was over there working for a month in that hospital, and during that time, every day it was like a daily occurrence where people would come in, brought in by their family members from the remote outlying regions, and they didn't make the journey. They were already dead by the time they made it to the hospital.
And how long is this journey?
Some people walk 4 hours, 8 hours, and a lot of the folks over there don't have any access to transportation. A lot of them don't even have shoes. So we're talking about people who were going through great lengths trying to get to the hospital when sick, and a lot of times, unfortunately, they didn't make it.
And again, this morning, in case you're just tuning in, we're speaking to Dr. Christopher Lewis. He's founder and president of Village Life Outreach Project, Incorporated. Now, you talked about this earlier, but describe to us in more detail some of the conditions you found once you arrived in Africa. Let's talk about the medical services, some of the medical facilities, the operating room, and patient areas.
Yeah, well, the best way I can describe it is, they do a great job of taking care of people, but they are really limited in terms of access to medications and supplies. There was one time, and I'm taking you back to 2003, May of 2003, which was my first trip. There was one time we were doing surgery, me and another doctor, on an emergency type basis in the middle of the night, and the lights went out. So we had to operate by flashlight. So that kind of gives you an idea of the conditions. We see a lot of malaria, a lot of tuberculosis, a lot of HIV. In fact, malaria is the most common disease that we treat when we're in Tanzania. 1 in 5 children over there is infected. It's a hugely dangerous disease for people to get. It's spread by mosquitoes, and thus is very easy to prevent with using a mosquito bed net that people sleep under at night.
Okay, so give us some idea of the living conditions there, what food is like, water sources, and schools. What are they like there?
Well, the water sources are a big issue. When we took our first group trip to Tanzania in 2004, it was a heavily medically centered trip. We took a lot of doctors, nurses, and students from those fields. The villagers sat us down and said, hey, this is great, but what we really need is some clean water, because half of the diseases you all are going to be treating is coming from our people not having access to clean water. So we instantly came back and got some assistance from the UC College of Engineering. Their Department of Environmental Engineering became our partner in 2005, helped us to train villagers on various technologies to clean the water. Really what you're talking about in terms of living conditions. Villagers, for the most part, live in mud huts with no plumbing. A lot of times the children, their first activity when they wake up, they got to walk anywhere from 20 to 60 minutes just to go fetch some water. The water sources that they do have are contaminated with bacteria, viruses, protozoa. They have been shared oftentimes with the cows and the chickens that are going in there and doing their business in the water, and then people, for the most part, have to drink this water. So it's very tough living conditions. You're talking about families that when they have kids, they don't expect all of their children to live. You're talking about an area where the HIV infection rate is about 10%. Life expectancy is about 48 years compared to 76 years here in the U.S. So you're talking about people who are really, really struggling just to make it. But despite all of that, the people over there are beautiful, and they have such love for others and such hope. It's inspiring.
And again, in case you're just tuning in, you're listening to Sunday Morning Magazine. I'm Rodney Lear. This morning, I'm joined by Dr. Christopher Lewis. He's founder and president of Village Life Outreach Project. Now, let me ask you this, Doctor. Once you arrived in Tanzania in 2003, this is your first visit over there. What were your initial thoughts, and was it everything you expected? What were your thoughts?
I was expecting to see poverty up close and personal, and I did, but what I expected out of the people was different. I expected that the people over there were going to be poor, and thus I thought that they would be hopeless. I did not expect to be embraced by the communities as much as I was. I did not expect that there were going to be so many similarities. It's easy when you're looking at or going into a different culture to only focus on the differences. Well, these people are poorer than I am. They speak a different language. They look differently than me. They eat a different type of food. But oftentimes, if you focus on the similarities, it makes your experience so much better because in the end, we're all human beings. And despite the poverty, people over there are living on less than $1 a day, yet they're still going through the same issues that we are here. They're still struggling to, feed their families, send their kids to school, take care of those around them. And the community environment over there is critical. And that's really how Village Life got its name. It's about us going to Tanzania and, through various projects, hopefully helping improve their lives, but also taking lessons that we learn in Africa and bringing them back here to Cincinnati and teaching people how to live that village life where you care about your neighbor, where you work together to educate the children, to feed those who can't feed themselves. And that's really what it's all about.
Okay, so help me to understand, when you traveled to Tanzania, were you able to take any medical supplies with you?
Yeah, we always, with our trips, and this started with the first group trip that Village Life took in 2004, we take a lot of donated medications and supplies, a lot of purchased medications and supplies. We have a lot of health organizations in town that have been supporting us from the beginning. The Health Alliance, which is now transitioning to UC Health, University Hospital, Children's Hospital, Catholic Health Partners. They've all been great supporters of ours. But when we go, we have a philosophy where we don't necessarily just want to give people a handout. With us, it's all about giving people a hand up. So while we might be giving people medicines and things like that, the majority of our projects focus on sustainability, where we want to empower people to take control of their own situation and give them the tools and the training they need to lift themselves out of poverty. And that's really a main focus of ours, is a hand-up mentality rather than a handout.
So let me ask you this, being a physician that you are, what's it like and you're in Tanzania and you're holding, let's say, a sick baby that's struggling to stay alive, and knowing that given the same conditions in the United States, that baby would be able to be cured, treated, or the disease managed. What does that feel like as a physician?
It's very hard. Every trip that we take, we encounter children who aren't going to be there the next time we show up in Tanzania. And that's probably the hardest part of Village Life, is not being able to do quite enough. So a lot of our work focuses on prevention, trying to prevent disease and trying to do as much as we can to make our projects sustainable. But it's a lot different than being a doctor here. It certainly keeps me grounded, and sometimes I share stories of Tanzania with my patients. When that patient comes in day after day or calls day after day complaining of that stubbed toe, sometimes I'll let them I'll tell them some stories about Tanzania just to put things into perspective and let them know, how lucky they are to be living in a city that has such excellent healthcare all around. And, quite honestly, regardless of whether you have insurance or not, if you have an emergency problem and you walk into University Hospital, they're going to take care of you, insurance or no insurance. And it's a luxury that a lot of people here in Cincinnati don't really appreciate.
And again, this morning, we're speaking to Dr. Christopher Lewis. I'm Rodney Lear. You're listening to Sunday Morning Magazine. Now, Dr. Lewis, in 2004, you realized your dream and founded Village Life Outreach Project. Tell us about the organization.
Well, it started off with an idea to help people in those outlying remote villages, the people who were dying on their way to that hospital that I worked in when I took my first trip by myself. That was the idea, is to serve these people that don't have access to the hospital, that are trying to walk 8 hours in labor while bleeding to deliver a baby. So I had an idea to get a few friends together and to try to take a trip where we could, gather our resources and really make a difference. A lot of it was modeled on my training at the University of Cincinnati, particularly with a group called Shoulder to Shoulder, which is a partner organization of Village Life. They work in Honduras and have had a presence there for about 30 years, led by Jeff Heck, who used to live here in Cincinnati. They really set a good model, and what we did was try to take that model and apply it to Tanzania, East Africa, and so far it's working. But it really took a lot of work from a lot of good volunteers from here from Cincinnati.
And again, this morning, we're speaking to Dr. Christopher Lewis. I'm Rodney Lear. You're listening to Sunday Morning Magazine. Now, you talked about this earlier, but I do want to talk more in detail about this. Not only have you been able to address the health needs of those living in Tanzania, but tell us about some of the programs you've been able to bring to the villagers to help them sustain themselves.
Right. So healthcare and sickness is just one component of what we do with Village Life. And again, it started from that first meeting with the villagers themselves where they said, can you help us with the water? So what we've done with Village Life is try to take an integrated approach, an interdisciplinary approach where we try to attack poverty from different ways, not just health, but also clean water, lifestyle, prevention, and education. Our mission statement is to unite communities to promote life, health, and education. So we try to take this multifaceted approach to fighting poverty, and it's a winning approach as far as we've seen so far, where you're not just tackling the health issues, but people can get sick from a lot of different ways, and if not having access to clean water is causing diarrheal illnesses and intestinal parasites. If you just take medicines and focus on the health aspect of it without trying to work on the water source and the quality and quantity of water that people have to drink, then you're just spinning your wheels. So that's the approach that we take, is that multi-pronged approach where we're really trying to address all of the needs of the communities that we work with.
And for me, Dr. Lewis, I think one of the most remarkable aspects that you've been able to bring to Tanzania is that you're actually building a health center right there. Tell us about the center, the medical center there, and tell us about some of the challenges you encountered in the construction process.
Well, we're still encountering challenges. Construction is scheduled to be complete within the next 2 months, but it has been a long process. It started in 2008 with our partners at the University of Cincinnati in the School of Architecture and Interior Design. Professor Michael Zaretsky is the lead architect on the project, and he's had over 200 students and faculty from UC doing research on sustainable design, low energy buildings, to really build a health center that's not just going to serve the healthcare needs of 20,000 villagers, but it's also becoming a nucleus of innovation for safer, more durable structures throughout the region. The idea was, take for instance Haiti. More people died in Haiti, not just right when the earthquake happened, but also because they were living and residing and going to business in buildings that just crumbled when the earthquake hit. So we didn't want to build a health facility that was going to crumble, because we are actually in Tanzania in a seismic zone. In fact, since we started construction in March 2010, there have been 3 earthquakes in the region, but not a single piece of damage to our building because of the extensive amount of research that Professor Zaretsky and the folks at UC have done. So it's a health center, and we're building it to take care of the health needs of the community, but also we want to hopefully spread technology that's going to lead to these safer, more durable structures for the whole country. And so far it's working. We're using an innovative technology called the interlocking soil stabilized brick, where there's a press that can basically make bricks out of soil, similar to what they do locally already. But instead of needing to be fired in a kiln, these bricks are made from a hand-operated press. They don't need any firewood to fire in a kiln, so there's no deforestation. And the resulting bricks that come out of the press that we've introduced to the region are about 3 times stronger than what they're currently using. So buildings are going to be better, stronger, safer, and we also have the added benefit of providing the first ever access to permanent health care for 20,000 villagers.